So welcome everyone to the third session of a call to action for self-care in viral times. And Audrey Schmaker is going to start us with a mindful moment. Thank you, Audrey.
Sure. So everyone, welcome, and bring yourself into a comfortable position and preparing for our next hour and kind of creating a space between what we just left and what's waiting for us when we get done. So allow yourself or invite yourself to come present. Check in with yourself. Take in a nice big breath and exhaling. Allowing your eyes to close or have a soft gaze. And draw your attention up into the crown of your head. Tapping the center of wisdom in all of us. And bring your awareness down through your forehead, your eyes, relaxing in your cheeks and jaw. All the way back to the ears. Taking a breath in, feeling the breath in your nose, your mouth. Cool on the inhale, cooling breath. And warm on the exhale. Softening in the throat and the shoulders. Down through the chest, back, and belly. Through your hips and pelvis and down your legs into your feet. Feeling your feet on the ground. Dropping your attention now from your shoulders down both arms, through your elbows, wrists, and hands and fingers. Simply breathing, you're noticing. And so opening your eyes, bring your awareness back to the room. Taking a nice breath, and if you want to stretch, go right ahead and stretch up. Alrighty, welcome back.
Thank you so much, Audrey. Again, welcome to everyone. This is the third in a series of three that we're calling a call to action, self-care in viral times. I had the honor and privilege of being up first, talking about how to reclaim our vitality through mental and emotional wellness. And last week, Shannon Gosen had a wonderful session with us on supporting our vitality with energy medicine and help to simplify some of these concepts and talk about bioenergetic devices as well. And this week, we're honored and privileged to have Dr. Huynh cover for us both personal protective nutrition and personal protective lifestyle. And for those of you who are joining us for the first time, and for those of you who've been with us for all three, the sessions will be available for replay via your registration following the completion and loading of this session. So for those of you who are waiting for the link, we're going to send it out all at once. And it's an honor to have you all here. We know everyone's time is precious, and it's a wonderful way to spend it. So thank you, Shannon. If you would please introduce Dr. Huynh.
My great pleasure to introduce my dear friend and this wonderful physician that I've so enjoyed working with over the last several months. and getting to know so much better. Dr. Mylene Huynh is a board certified family medicine, preventative medicine, and functional medicine physician. She serves as a pain management physician at the Walter Reed National Military Center. So Dr. Huynh is passionate about vibrant health, which you're going to experience today. And after 21 years of active duty service for the U.S. Air Force, she actually founded True Point Health in Fairfax, Virginia. And this was to serve her community in reversing chronic disease and also empowering well-being, which is what we're talking about in this series. And she wanted to have this available directly to her patients. So she holds an appointment as adjunct assistant professor in the Department of Preventative Medicine and Biometrics. And this is at the Uniformed Services University of the Health Sciences in Bethesda, Maryland. And it is my great pleasure to introduce you and have you start this amazing lecture. Thank you.
Thank you, Shannon. Thank you, Lisa, for the summary, and Audrey for the mindful moment. So I want to start by acknowledging Task Force Resilience. So Audrey, Lisa, Shannon, and I are part of this task force. It was an ad hoc task force of like-minded, light-hearted individuals from the Department of Defense as well as civilian from across the United States. We started meeting back in April. Started meeting weekly, it's now bi-weekly. We have a shared vision for resilient and vibrant health for our communities. I want to say that our work was highlighted recently by the military health system on their website. So just to review the threat, coronavirus disease, or what we call COVID-19, is caused by severe acute respiratory syndrome coronavirus 2. We shorten it SARS-CoV-2. Like Shannon mentioned, it's a novel RNA virus, and it uses this spike protein to latch onto our angiotensin converting enzyme 2 receptor for entry. And we have a lot of these receptors throughout our body, and most prominent, most abundant in our lungs, our intestines, our kidneys, and blood vessels. Because it's a new virus, we have limited adaptive or acquired immunity. There's no antibody to fight it once it enters our body. And it has the capability to disable part of our innate immune system, the macrophage in particular, which is usually our first line of defense. So the complications that we're seeing among our patients is what we in the military call the fog of war. When our immune system fight this virus, what we're seeing is significant inflammation in the body, a cytokine storm, oxidative stress, hypoperfusion, blood doesn't go where it needs to go, vascular dysfunction, endothelial dysfunction, and microemboli. So of interest that only a fraction of SARS-CoV-2 infection are actually diagnosed and reported. This was a study published in July where researchers went through 10 different sites in the United States, and they tested the population. And it turns out that within our population, we had seen people who had that infection, had no symptoms, and maybe up to 10-fold more having an infection without symptoms than that's been reported. So the good about this is that many people may have already been infected without symptom or illness. The bad is that we can transmit SARS-CoV-2 without symptoms, and that's why wearing a mask when we're within 6 feet of another person is a good idea. It's really an act of compassion so that if we do carry the virus, we're not giving it to another person. The ugly about this is that it's very difficult for public health to contain this virus when there may be a large number of the population may be infectious without symptoms. The CDC is doing a large seroprevalence study And we will have more information on this later on. Another thing of interest regarding this disease is the clinical manifestation. Up to 45% of people may have no symptoms at all, but still can transmit up to 14 days. The median is usually around 7 days. Majority of people who have gotten this virus do pretty well. 80% experience mild to moderate. They recover at home. They experience fever, cough, or they may progress to shortness of breath. And that's the 20% that experience severe critical complications that require hospitalization. They may require ICU admission, ventilators, and there's a pretty high rate of mortality in the ICU setting. So what's the difference between those who survive and those who don't survive in an ICU setting? So this was a study published in The Lancet, and the top charts show those who survive, and the bottom those who did not survive. And they mapped out by symptoms, fever. You can see that survivors and non-survivors really don't have any difference in terms of their symptoms of cough, difficulty breathing. Both survivor and non-survivor got ICU admission. And then at some point, and they were from 12 to 14, those who don't survive develop acute kidney injury, acute cardiac injury, and severe infection, and ultimately death. So why the variation? So it turns out that diseases don't occur randomly. I obtained my Master of Public Health in Epidemiology, and one of the things we learned very early on is this particular triad, epidemiological triad, which is the model of disease causation. And there's 3 factors. In this case, the agent is SARS-CoV-2, the environment, how close you are to the person that carries the virus, healthcare system, economic, and politics may influence this. But one thing we all can control is this top up here, is the host factor. And that's why it's important to talk about immune resilience, and I will talk about nutrition and lifestyle. And just like what Lisa mentioned, how we think, what we think do matter, and I'm going to talk about what we eat and what we do also do matter. So just to summarize what I just shared with you on a longitudinal scale here, so we have a lot of effort in prevention, wearing a mask, hand washing, physical distancing. And then at some points, people may get infected and up to 45% have no symptoms. And there's a period when people have symptoms from 2 to 14 days. And then at some point, people either recover, do well at home, or require hospitalization. Another tricky thing about this virus is that we can be infectious up to 48 hours before we have symptoms. The current US response is this way. We have health measures in place to prevent, contain, treat severe complications. Primary prevention is basically preventing us from getting the infection at all, and that is in physical distancing and wearing a mask, hand washing so that we don't infect ourselves. Secondary prevention is basically lab testing. We're testing a large number of population, testing household contacts, and so on to contain the virus. And early on as a nation, we had a campaign to flatten the curve, and basically that is to give hospital and ICU a chance to prepare. What's missing from this, in my belief, is that we don't fully address the human factor, the host factor in that epi triad or resilience. And treatment today is quite varied because patients present in such different ways. There's mild, moderate, critical, and then death. Today, there is no tertiary prevention. What tertiary prevention means is that if you are tested positive, we intervene to prevent complications. We We have no recommendation for early outpatient management or protective therapeutic. And hospitals across our nation have such significant variation in management, and that is because of the host factor, that each patient who shows up to the hospital have different immunity, inflammatory, and microbiome status. So what we propose is, in addition to the current approach, we bring in immune resilience. Immune resilience is basically integrating the science of nutrition, lifestyle with immune function. Starts with self-care, building resilience with personal protective nutrition and personal protective lifestyle. And perhaps early intervention after a positive COVID test or after exposure, and not waiting for severe complication to intervene. And we need to protect high-risk populations, our frontline personnel, our caregivers, household contacts, vulnerable population that we define as advanced age, those with chronic diseases such as kidney disease, COPD, diabetes, hypertension, obesity, and others. In the United States, 6 in 10 adults suffer from a chronic disease. That's a huge part of our population. And 4 in 10 have 2 or more chronic diseases. It is estimated that up to 45% of US adults are at increased risk for complication from a coronavirus because of chronic diseases. So you hear the news a lot about advanced age being a risk factor, but aging, there's chronological aging, which start at birth and end with old death. It's a time factor, but there's also biological aging. We Americans, because of our behaviors, actually age faster biologically than our chronological age, by 4 to 5 years faster. And a quarter of Americans may be 8 years older biologically than chronologically. You hear a lot on the news maybe about how the immune system is impacted by advanced age. So why is that? There's a concept that we call in medicine immunosenescence, and basically what that means is our immune function declines with biological aging, and both our innate as well as our adaptive immune system. So it turns out that after midlife, chronological age does not predict biological aging, as this chart shows you. When we're younger, for our middle age, chronological and biological age can kind of predict each other, but after middle age, it's really about how we take care of ourselves, and lifestyle factor and what we eat play a huge role. If you're interested, there is a COVID age calculator that basically calculates your biological age, and there's just the website right here, profile.covid-age.com, and you just put in your age and a couple of other factors like your waist, your weight, your blood pressure, vitamin D level, and other factors, and it will calculate your biological age for COVID. So the science is quite clear. Lifestyle-induced chronic diseases are preventable and reversible. We know that lifestyle do add and contribute to worsening of these diseases that are listed here, from heart disease, stroke, diabetes, obesity, metabolic syndrome, chronic obstructive pulmonary disease, and some cancer, all are risk factors for severe COVID complication. Dr. Dean Ornish devote most of his medical career into studying the reversing of chronic diseases. He published a book called Undo It last year. And basically he concluded that, latest study are showing that lifestyle changes are actually better than drugs and surgery in reversing many of our most prevalent chronic diseases, including heart disease and prostate cancer. So why doctors talking about the host factor, resiliency, nutrition, and lifestyle. So while it turns out there is a research translational gap of 17 years, I learned this 20 years ago when I was getting my Master of Public Health, and I just couldn't believe, like, wow, it takes 17 years for research to be implemented clinically. That's just wrong. Even though today we know that nutrition and lifestyle factors do modulate proper immune response, decrease inflammation, support a healthy gut microbiome, can decrease oxidative stress, prevent endothelial dysfunction, so keeping your blood vessels strong, protect our gut-brain connection that Lisa talked about, increase our telomere length that keeps us younger, delay biological aging, delay immunosenescence, and reverse chronic disease. So it's really important that during the pandemic, we talk about nutrition and lifestyle. There's a beautiful study that was published by Dr. Yannick a couple of months ago that talks about how if we can lower our underlying inflammation level, perhaps we can prevent severe complication. So that leads us to personal protective nutrition. And this is the work done by Task Force Resilience. We define PPN as food and nutrients that enhance immune and metabolic resiliency to reverse disease and optimize performance. And you'll have this slide available to you where we walk you around this honeycomb, and everything that's underlying, if you click on it, is a hyperlink to the Human Performance Resource Center by DOD that give you the evidence and more information. So we could recommend eating whole food, mostly plants, every meal, 50% vegetable and fruits. Aim for 5 to 10 servings of vegetable and fruits daily, whole grains, and other quality protein sources. During this time, add some herbs and spices to our cooking. Curcumin, turmeric has anti-inflammatory factors. More nutrient-dense and low glycemic index food, and be sure to hydrate well. Fiber is really important as a way to detox and clean out our system daily. We recommend 30 to 40 grams daily, and only apparently 4% of Americans actually meet the daily recommended fiber. A lot of plants, protein, so getting protein from your plant source, and then avoiding chemicals. And so you can see that you can march around this honeycomb. We recommend eating rainbows of color daily. Food first. Food is so key in eating as close to the source as you can, organic, if that's available to you. And then building a robust, diverse microbiome as a way for resilience with prebiotics in vegetable, fruits, fibers, and then probiotic food in kimchi, sauerkraut, kombucha, and so on. And then I'll touch on a little bit about supplements later on. So it turns out the flavonoids that we found in plant, and this is a systematic review and meta-analysis. Meta-analysis is sort of the gold standard of medicine. And it showed that eating a diet that high in flavonoid decreased upper respiratory tract infection without any side effects. So vegetable is the way to go. I would also want to emphasize nuts and seeds because of the zinc content. So zinc has a role in inhibiting viral replication. And there was a study published in 2010 that looked at SARS-CoV-1, which is the cousin of this particular virus, SARS-CoV-2. And in the laboratory, zinc with a zinc ionophore, something that brings zinc into the cell, actually stopped the virus from replicating. So get zinc from your vegetable, fruit, nuts, and seeds, and dark chocolate as well. A lot of studies on not only zinc blocking viral replication, it's been known to be the gatekeeper of our immune function, in that it modulates our immune response. Another thing I want to introduce you that's found in vegetable is quercetin. Quercetin is basically the plant flavonoid, is the pigmentation that you find in your vegetables and fruits. Quercetin is a very potent antioxidant and a zinc ionophore. It actually brings zinc into your cell. It itself can inhibit viral replication. And quercetin can be found in apples, peppers, citrus fruits, cherries, things like that, also in green tea. All right, a little bit on supplements. I recommend that if you're going to start a supplement, make sure you discuss with your doctor. So daily essential during pandemic, perhaps zinc at 15 to 25 milligram daily because it can inhibit viral replication. Vitamin C has a role in modulating cytokine production. Vitamin D is a major immune modulator. I think it's direct immune response. And there are plenty of studies to show for those who are over the age of 50, we can benefit from a multivitamin that contains A, C, D, E, B, selenium, zinc, and magnesium. Eat plenty of vegetable and fruits and fiber, and ensure adequate hydration. And it's really important when you eat that you don't drink water. And here's why, because when you're eating, your body is producing digestive enzymes and gastrin to digest your food, and you don't want to dilute that. You actually want your body to take advantage of all that digestive enzymes and gastrin juice to digest the food so you can absorb the nutrient. We recommend that you stay hydrated all day long, take your weight in pounds, divide it in half, and drink that in ounces daily. Other consideration, zinc ionophore, can serve to bring zinc into your cell. Quercetin, green tea. Curcumin is a significant anti-inflammatory, it has significant anti-inflammatory role. It serves as an IL-6 inhibitor. So those who have underlying medical condition with high inflammation, maybe discuss with your doctor about curcumin as well as omega-3. Melatonin is also anti-inflammatory. We also recommend that you purchase your supplement, know where they come from. There are companies that are more reputable than others, and you want companies that have third-party testing. And look specifically, if you purchase from your local drugstore, look for these labels: NSF, USP, or Consumer Lab. All right, move on to personal protective lifestyle as the way of living to enhance immune and metabolic resiliency, to reverse disease and optimize performance. I'll touch on sleep a little bit more later on, but stress management. Lisa has shared with us how important that is to really be aware of your thoughts and getting to neutral as a way to manage your stress. Exercise is key. Getting daily, moderate, some type of physical activity to enhance our immune function. Staying socially connected, even at a physical distance. We are social human, and that social connection does boost our immune system. Time in nature. Time in nature not only to get vitamin D, but also there's study to show that spending time in the woods boosts our natural killer cell, our innate immune system. Just a walk in the forest will boost your immune function. And then choose to have a resilient mindset. What that means is you seek the good in everything and find peace on things you cannot change, and stay adaptable and develop compassion and empathy.
Before we go on, Mylene, if I may, Of course, this is my bailiwick, so I get all excited. I wanted to add to what I presented, and not only being in the awareness, but we also need to be good time managers as we do our self-care, because not only the food preparation, but the physical exercise that we'll be talking about as well, has an effect, obviously, on everything that we're discussing. And so it's a matter of planning well enough to accommodate the things that we want to do to care for ourselves as well. One interesting note, because I also spoke during my session about being in the awareness of the physical and visceral sensations that we feel. Oftentimes, what we might interpret as anxiety is actually the body's cues saying it's hungry. And we get so busy and caught up in our day that we're not taking the time to eat properly in regular intervals, etc. So I just wanted to throw that in. Of course, the other part of my background is project management and program management. So it's all about critical path method and getting things manageable so that you can work through your regular day, whatever that is, wherever that is, and still accommodate all of this wonderful self-care that's so important to our immune systems and our digestive systems. So thank you for letting me share that.
Thank you, Lisa.
Yes, and if I can just add on one point on that for any of our viewers, whatever your profession is, whether you're a practitioner, whether you're basically a consumer of medical care and just wanting more information on this. Some of us have these really, really complicated schedules, and we actually have more demands on us if we're working from home and we have kids that we're homeschooling, or we have other responsibilities. And it's helpful, as you know, it's been said, make sure you schedule yourself first for all of this, for self-care. And sometimes that means that you're going to want to do this first thing in the morning. Schedule that time for yourself on what you're going to do for this lifestyle and self-care and meals, and take care of yourself first every day, because we all know that as the day progresses and things happen, we can just be overcome by events. So if you're looking at this list and it might seem overwhelming, maybe there's a few things that you're going to target on it immediately, and then it's like, what can I do for myself first thing in the morning to prepare and really, really support my well-being and my lifestyle.
And that's going to increase the vitality quotient as well. I'm interested to hear how people have been upping their vitality quotient. Thank you, ladies.
Thank you. All right. Thank you, Shannon. Thank you, Lisa. So sleep, I want to talk a little bit more about sleep, because we all sleep, we all eat. So sleep is so key. And during a pandemic, I encourage all of us to get 7 to 9 hours of restorative sleep every night, because proper sleep boosts your immune function. And a night of poor sleep decrease our natural killer cell, part of our innate immune system, that first line defense, by 40 to 70%. Increase epinephrine that makes us feel more stress, activate NF-kappa B and IL-6, which is part of our pro-inflammatory system, that the same system that's activated by COVID. Also, it turns on our pro-inflammatory genes if we're not getting enough sleep. Poor sleep increases blood sugar, it leads to weight gain and risk of dementia. I recommend a regular sleep and wake time before bedtime. Create a nice ritual for yourself. Like make sure the temperature is not too warm, not too cold, no sound, no light. Really limit your high intensity exercise for about 2 hours before your bedtime. And no alcohol and caffeine for 4 to 6 hours. Been reported that half-life of caffeine can be anywhere from 4 to 6 hours. And then turn off electronics so that the light from the all electronic devices are not tricking our pineal gland. The pineal gland, the part in the back of our brain here, is what produces melatonin, and melatonin induces sleep. It's activated by darkness, so light would suppress melatonin, and melatonin is found to be an antioxidant, anti-inflammatory, anti-excitatory, and immune regulation. And what Shannon shared with us last week the importance of mitochondria being a key part of our energy system. Melatonin protects mitochondria against free radicals. And it's of interest, a lot of our understanding of melatonin came from a study on cancer patients. Meditation. So this is the slide Audrey had built. So meditation is one of my favorite things to do daily. It builds our immunity because meditation is shown to influence markers of inflammation. It decreases inflammation. It boosts our cell-mediated immunity and delay biological aging. And it's really good for our immune system. In fact, there was a study that looked at meditators and influenza vaccine, and it turns out those who meditate around the time that they get their flu vaccine have a better antibody response. So I also want to emphasize vitamin D, just because in the United States, up to 89% of adults are vitamin D deficient. Deficient meaning less than 40 nanogram per milliliter. For our Black and Hispanic communities, that number goes up to 97, 98%. So really during a pandemic, and we're going into the winter months, we need to get some sunlight when we can. We know our vitamin D level so we can better protect ourselves. So I want to end by summarizing our current response and have us collectively on this call to kind of think about other gaps in our response and how we can do better, especially for those clinicians on the call. So currently we have primary prevention, which is this PPE, physical distancing, quarantine, testing. But we are also proposing, let's focus on the host factor, build resilience. Let's make nutrition and lifestyle just as important as PPE. And for those frontline personnel and our most vulnerable, should we be checking their vitamin D to optimize their immune response? Should we be thinking about maybe giving them a vitamin with zinc and magnesium, selenium, and other things? And the reason I put that there is a study has shown that, and this is a quote, that nearly entire US population eat a diet that's not on par with recommendation. And only 1 in 10 Americans actually eat the recommended vegetable and fruits. And that's according to the CDC. And that's what I thought, well, unless we all start eating our vegetable and fruits and fiber and grains, maybe a multivitamin during a pandemic won't hurt. And then for those who are tested positive and their families and close contacts, should we be thinking about protective therapeutics? Should we be thinking about maybe zinc, vitamin C, and vitamin D, and a zinc ionophore during the 10 to 14 days, from during that time where we don't know if they're going to be part of the mild or moderate or the severe. That is part of your secondary and tertiary prevention. Secondary is like treating the household contacts, and tertiary prevention would be treating those who are positive, and we're just waiting to see if they're going to get worse or not. The reason I bring this up is there was a study published in the Journal of American Medical Association in August, and this study came out of Italy, and it highlighted, called attention, the medical attention to these long haulers, where up to 80% of patients who've had COVID have persistent symptoms, 2 months, up to 2 months after the infection itself. And those symptoms include fatigue, difficulty breathing, joint pain, chest pain. Those who experience 3 or more symptoms are up to 55%, and almost half of the population that were studied reported worsened quality of life. So I often tell my medical student, medicine is really like football. You can actually win with strong defense. And my oncologist friends will also agree in that we would never use medicine that is too strong if the patient resilience is not strong. So maybe during this time that we got to build our defense a little better, because pandemic defense is immune resilience. I want to highlight the checklist that was developed by the Consortium for Health and Military Performance here on the right. And the website is hprc-online.org. It is a Department of Defense resource, but it's available for all of us. And what I really like is they have this link where you can ask the expert. If you have a question about supplements, about nutrition and lifestyle, you can submit a question and it will be answered. They will review the evidence and give you the most current evidence-based answer. And that is the web down hprc-online.org. So for those clinicians on the call, when we became clinicians, especially for physician doctors in the United States, we took a Hippocratic oath. And the oath is first rule, do no harm. So I think about often the benefit and harm of early intervention for COVID patients with zinc, vitamin C, vitamin D. Is there an ethical dilemma in waiting? Why are we waiting? The patient are critical and need hospitalization to intervene. Is that in compliance with do no harm? What's the benefit of protective therapeutic for up to 10, 14 days when patients are tested positive, giving our patient zinc, vitamin C, and vitamin D, and the harm of doing nothing? And there's certainly no harm in resilience in PPN, PPL with your PPE. So I want to conclude here, and it is a call to action for all of you on the call to start, like Lisa and Shannon has already mentioned, that self-care. Start with taking care of ourselves. We know a lot about PPE over these past months, but making sure that we're eating a diet that is protective to our health and living a lifestyle that includes a balance of work, life, sleep, exercise, and spending time with our loved ones. The wisdom of medicine is really what we think, eat, and do matter. And as demonstrated so clearly during this pandemic, that our well-being are truly interconnected. So how do we collectively empower healthy communities and acting smartly together? I think SARS-CoV-2 is a piece of small microscopic virus, really don't have power. We do. The host factor is so key in this pandemic. So my vision, I know it's shared by most of our task force resilient members, and that we see and we hope in our lifetime to see a healthcare system that focuses on prevention of illness and disease. So with that, I end my presentation and we're open for questions.
Wonderful, Dr. Huynh. So I actually, as a physician, I have a couple of questions I'd like to ask for all of our viewers. First, when you were in medical school, how much nutrition training did you get?
Zero.
Okay.
None.
Okay, so that sets me up for the next question. For people that are going into their physicians and wanting to say, can you please guide me, and should I be taking these supplements as a preventative and that tertiary care, what does one do when they have a physician that says, oh, well, there's no evidence that any of that works and you don't need to be, taking it. I didn't learn anything about it in school, or whatever it might be. What does someone do when they're actually, trying to do the right thing by collaborating with their physician and healthcare provider?
Oh, great question, Shannon. So in medical school, I went to medical school, graduated almost 25 years ago, and we did not have any nutrition. Focus was on disease, drugs, surgery, and I would say a lot of my friends and colleagues discovered nutrition largely because we want to be healthier for ourselves and our family. So if your physician has no interest in nutrition, then work with a nutritionist, work with a health coach, work with other coaches who they're in fitness coaches have experience and more experience on nutrition than most physicians do. Also, functional medicine physician who is certified in lifestyle medicine, a member of the physician committee for responsible medicine. I mean, I can go on and on. Those are physicians who went out their way to get more education and training on nutrition because they realize that's a huge part of health and well-being.
Yes. And you're a certified practitioner through the Institute for Functional Medicine. I did my AFMCP with them. There's a lot of patient resources and resources just for the general public, even on the IFM website as well. And then now we've got even like a second dilemma because at least physicians are, there's this thing called evidence-based medicine, which is where physicians are actually asked to go into the literature and see what the best practices are, which you brought up. And one of the challenges with this novel virus is there is no evidence because this caught everybody off guard and we don't have any research on it. So evidence-based medicine is coming from a clinical perspective. And then you've got physicians that have a different clinical perspective depending on what they've been using. I'm going to call it in their arsenal, whether they know about nutrition and have been doing this frontline. So then what's your thoughts on that from the standpoint of how it's a little tricky with the evidence for this?
Yeah, so Shannon, so Institute of Medicine, I think about almost 10 years ago, published a report that actually stated that maybe randomized control trial is not necessarily the gold standard because randomized control trial, we're comparing one drug to a placebo. And in clinical practice, I would never ask my patient, would you like this drug or nothing? I would usually ask them, would you like this pill, this supplement, or would you want to try certain therapies first? So usually in clinical practice, we give our patient options. Currently, during a pandemic, or lives are being lost, I think clinical experience of what we're seeing clinically is so important to help patients build the resilience, and if they have infection, to not develop the severe complications.
Yes. And evidence-based medicine always was meant to, what's the evidence, who's the person, what's the circumstances, what's the socioeconomics, what's appropriate underneath this, underlying all of it. May I ask you a few questions that are coming in on the chat and
Sure.
comments? So this is from Carolyn. She says, I'm a non-physician. I always bring the peer-reviewed research into my physician when I have a question about a particular food or supplement into our routine. So that's terrific because right now we do have some very good evidence, certainly on D3 and taking D, right? And zinc and vitamin C and several other things. Those are my don't leave home without it. And then Jill says, thank you for today's talk. Amazing thinking processes, best practices always. And then we have another physician, Dr. Park, is a physician assistant and recently has chosen a nutrition outreach fellow with the PA Foundation. Just wanted to let everyone know that our national organization has created educational modules regarding nutrition for PAs, physician assistants. So if your provider is a PA, there are free resources available to get education. So it is part of that 17-year cycle, isn't it, where they're finally catching up. And then Pamela Howard, acupuncturists can often speak to foods from a TCM standpoint. Absolutely. And as an acupuncture physician, I'm able to do nutritional counseling and supplementation and the testing and all of that.
And TCM being traditional Chinese
Chinese
medicine,
medicine. Thank
being
you.
sensitive to acronyms.
Thank you. It's not today's chocolate milk.
Those are all the comments and questions in the chat.
Come in so far, yes.
Well, I would love to get participants' input. I mean, I think it's okay if you're okay, turn on your camera. I think this is a good time. We purposely decided to keep today's presentation short so that you get a chance to ask Lisa, Shannon, Audrey, or myself any questions. And then really love to hear your ideas about how do we build more resilient communities during the pandemic. And how do we share information so that others can benefit and be as healthy as we can be?
See if we have. Oh, hi, Monica.
Hi. I have a question. I have two boys that had COVID, and one of them seems to be doing better, and the other, one of my sons who's 19, I would say is having some sort of maybe memory loss and more memory issues and brain kind of issues. And I guess I am using microcurrent with him when he'll be willing. And he's taking vitamins, but I guess I'm just wondering from a standpoint of what else could I be doing now that he's already contracted the virus and he's showing some interesting issues.
Yeah, so I would go back to what Shannon shared last week. I think what the scientific community is still trying to understand what this long hauler syndrome is all about. Why are people suffering long after the acute phase? And I think the model that explains this well, like the best, is the cell danger response. The cell danger response basically so that the mitochondria respond to this attack on the body, and it has not been able to return to its normal function. So the oxidative stress load is great. So anything you can do to decrease oxidative stress on his body, so personal protective nutrition and personal protective lifestyle, make sure he gets enough sleep and spending a little time outdoor. Those are very critical. You're already on top of the vitamins. And I think one of the best things is probably the availability of microcurrent that you're doing for him. Shannon, anything else to add?
Yes, so I wholeheartedly agree with that. And of course, I've had now over 20 cases of, where people have had COVID, and I have a variety of experiences, but there's a lot of at the brain, I'm going to call it brain dysfunction, that is going on with people that have these ongoing symptoms, and there is that mitochondria side of it. Dr. Huynh had the same experience using that CDR, cell danger response mitochondria repair protocol has been very, very helpful. We've had good experiences with that. And then, I'm going to suggest to everybody exactly what Dr. Huynh has said to all of you in this. So important to protectively make sure that your vitamin C, zinc, and D3 especially levels are up. And then I also use N-acetylcysteine to increase glutathione, which is critical for the immune system and also helps with sleep and is produced with sleep as well. So there's like if you're stranded on a desert island with a bunch of people that could infect you with COVID, there's a certain bottles of vitamins that you want to make sure you land on that island with. And those are those that she was talking about. And we, from a tertiary standpoint, and even before, protect ourselves. And then if you get it, make sure that people know that there's something they can be doing. It dramatically changed the outcomes of the people that I was taking care of, that I could get them on all of that and doing the microcurrent.
Yeah, in my clinical experience, I've had patients in their 70s, one in his 80, that had COVID, and they all did fine. They actually had diabetes, hypertension. I have a patient in her 70s that has pancreatic cancer, and that is all my patient. I made sure that their vitamin D level is optimal, and they were on a multivitamin that had zinc and magnesium, selenium. The only patient that is still suffering was the patient I talked about last week, who came to me 4 months after he had COVID, and his vitamin D level was extremely low. So based on my clinical experience, I say vitamin D is really important.
Yes, and that reminds me that one of the things that we're seeing with the younger population is that people look healthy. And so people are being said, oh, this healthy person got it and got these really bad symptoms. I'm going to suggest to everybody that there is probably an underlying inflammatory problem where you need that cleanup on IL-6, low vitamin D levels, or predisposition to some kind of possible just genetic predisposition that is not expressing itself. So they may appear healthy on the outside, but maybe not so much on the inside. What would you say to that, Dr. Huynh?
Oh yeah, absolutely. I think just the nature of our lifestyle, living here in America, stress is such a huge factor. A lot of people eat fast food that we know that standard American diet trigger IL-6 inflammasome. So there are a lot of things that are just smoldering that we don't know. And then here come a virus, and our body respond appropriately by fighting the virus. So if you already have an underlying inflammation that may have no symptoms, and then you have more inflammation because there's a fight going on in your body, then that's where we're seeing complications.
Yes.
Yeah. For our elderly patient, I do recommend that they have a way to monitor their oxygen concentration at home if they happen to get COVID, because what we're finding is that people will be fine and then they get really sick. And I know that the Indian Health Service, just because their hospital, I have a friend who works with the Indian Health Service, and that their hospital is so far away and on the reservation that it's hard for patients to get back. So right now they are checking vitamin D, giving patient vitamin D after COVID, and loaning out a pulse-ox meter so that patient can monitor at home. So if their pulse-ox drop, they start to make their way back to the hospital. And I understand that that is saving lives.
Yes. Public service announcement on that. I encourage everyone to make sure that you've got a pulse ox at home, because one of the red herrings on this is if you get it, you just think that you're tired because you're sick, and you don't realize that the reason that you're passing out is you're hypoxic. So you don't actually know that it's that oxygen problem. So really, everybody probably, get your toilet paper and your pulse ox, that stock up and make sure you have it, because that's probably just the most powerful indicator for having that lung problem. So we've got a comment from Dr. Zumwalt, who is also on the call. So glad you're here, Dr. Zumwalt. She's just been an amazing resource for people in helping with the microcurrent. So she said, when I went to the emergency department and radiology departments recently, no staff, that's all capitals, knew about or were taking vitamin D3. So that goes back to that, what do you do when your medical doctor doesn't know that there's actually data and research? And then see all the grassrootshealth.net studies. Okay, why are the hospital staff and other first responders resistant to taking vitamin D3 and zinc? ? Vitamin D3 has other immune enhancing properties. Finland National Health wants every Finn to have blood levels between 80 and 100 nanograms per milliliter. What would you say to that, Dr. Huynh?
The Finn is onto something good.
Yeah, do you have colleagues where you are that are resistant?
No, when we share,
Okay.
Dr. Chris Edens and I put together a really short summary of some of the research on zinc, vitamin C, vitamin D, and others, and we share it with our colleagues, and they were very appreciative. They're all on it. I hope they're sharing with their patients.
Right, and that's the educate the front line, and then have them sharing it, and then the physicians need to be sharing with other physicians. Yes. Any other questions or comments?
I wanted to add something to Monica's question, excuse me, about the brain health And there are also many smart technologies available that can help to create neural pathways. So to investigate the brain health angle of this as well. And Dr. Daniel Amen and his clinics come to mind as a resource for that as well.
Good. So I guess we're right at the hour. I really appreciate everyone being here today and participating. And I hope you take this information to help yourself, your family, your community. Do share with others. And thank Shannon, Lisa, and Audrey, who's going to close with a mindful moment for us. I think you're on mute.
Oh, I was, yep. Sorry. All right, so really let's all close our eyes or find a spot to gaze on and take a nice deep breath in. All done, and finding a moment for gratitude for this gathering, the generosity of all the presenters sharing from their heart information for all of us. Breathing into that sensation of connectedness, connection with each other for our own health and the health of our families and our loved ones. Taking a moment to feel that warmth in your body, in your mind, in your spirit. And consider sharing with other people what you learned here today. Take in another deep breath. Exhale. Open your eyes. Thank you. Thank you, Mylene, and everyone.
Thank you.
Thank you, Audrey. Thank you, everyone. Stay healthy, be well.
Yes. Yep, it is.
Thank you.
Beautiful job, Mylene.
Oh, thank you. Beautiful, Audrey. I love the meditation. Carol, it's good to see you. Looking well. I see Tamara. Huynh, it's good to see you too.
Questions. That's